Welcome to your introduction to PowerChart. In this video, you will learn the basics of navigating and using PowerChart to manage patient information efficiently. PowerChart is an electronic health record system designed to streamline clinical workflows and support efficient patient care. As a clinician, becoming comfortable with PowerChart's interface and navigation tools is essential for accessing patient information quickly and accurately. This video will guide you through the basics of the PowerChart interface and navigation, helping you build confidence and efficiency in your daily practice. By mastering these foundational skills, you'll be better equipped to deliver high-quality care and make the most of your time with patients. To access PowerChart, you will need to click on the PowerChart app to download and launch it. When downloading, you can right-click on the download to set always open files of this type. PowerChart will now open. In the grey banner at the top of the screen, you will find some useful links to help you navigate around the system and some links to useful external sites. You can set up and use various patient lists to view patients. You can also see there are links to some external systems such as Patient Track to view patient observations, ICE Desktop to view bloods, microbiologies, and histologies, LPRES Viewer to view the GP record and external documentation, and also Sectra to view radiology reports. If your patient is not visible in a list, you can search for a patient using the search bar function at the top right of the screen. If you've searched for this patient recently, you may find them by using the drop-down arrow. Otherwise, you can enter the MRN, which is the medical record number, into the search field. Or for a full patient search, just click on the magnifying glass. We can then search by name, hospital number, or NHS number. Once these details have been added, simply click Search, and the patient details will appear in the top section on the right. Always scroll across to confirm it is the correct patient. Then, in the bottom section on the right, it is important to make sure you are selecting the correct encounter. As all patient encounters appear here, it is imperative the correct one is selected. Once selected, click OK, and the patient's record will open. If you are accessing the patient record from a patient list, simply double-click on the patient's name. If the accessible information hasn't previously been completed by yourself or a colleague, the following screen will appear. This must be completed for all patients. To gain access to the form, you would click the Access Info button. At the top of the form, you will see three options. Medical emergency can be used if you need to gain access to the record in an emergency situation. Patient not present. This can be used if you do not currently have access to the patient. Otherwise, selecting No Override will allow you to proceed. If the patient does not have any long-term impairment, click No and sign the form by clicking the green tick in the top left. If the patient does have a long-term impediment, click Yes and then select one of the impairments from the list below. You will then gain access to the Reasonable Adjustments tab on the left. Click this and again document as required. Once this has been completed, click the green tick in the top left to complete the form. This form only needs completing once, and the result will sit in the Flags and Alerts section. It is important to read any discern notices that appear. If the alert is firing for you, and you are communicating with the patient, you have a professional responsibility to complete it. Once this is done, the record will open. You will then see the patient's name in the top left of the blue banner. Underneath the name, you can click onto Allergies to see any allergy information for your patient. If you can see flag and alerts, then clicking on this will show any flag and alerts that have been recorded. Moving across the blue banner, you can see the age, date of birth, rhesus status, and any isolation precautions for your patient. Next are the NHS number, hospital number, and gender. And finally, the current encounter details. If you need to change patient encounter, you can do this by clicking on the current encounter and then selecting a different one from the list. All other patient information can be found in the blue menu on the left-hand side of the screen. Once opened, this menu can be pinned open for your convenience. The menu is made up of a list of useful views for your role. I will now give you an overview of some of the ones you will find useful in your role. Firstly, let's look at Results Review. Here we can see any recent results for our patient. There are also laboratory results which include urinalysis and blood gases, radiology reports, and any recent and past vital signs that have been recorded. Finally, in Assessments, you will see any nursing and risk assessments that have been completed. Moving back to the blue menu, we will now look at the drug chart. At the top left, there is a drop-down box to select different filters for the drug chart view. It will default to all medications, but we can change this as required to view active, inactive, all doses, and so on. You can also tick or untick the type of medications from the list on the left as a further filter. In the main body of the screen, you can see the up-to-date drug chart for the patient. This contains the name of the medication and the order sentence for that drug. We can also see when the drug is next due, if it has been administered or not, and the reason why not, and if it is overdue. You can change the time frame by right-clicking into the grey banner at the top, and you can set as today's view, or change the search criteria as you wish. Next, we will take a look at requests and care plans. Within the main body of the screen, you will see anything that has been automatically and manually ordered for your patient. This includes nursing and risk assessments, medications, and referrals. For further information, just right-click on the order, and you will have the option to view more order information. From the section in grey on the left, you can view patient care plans that have already been initiated for the patient, and also any suggested care plans that have not yet been initiated. From the blue menu, we are now going to look at documentation. From here, you will see all patient documents, including radiology reports, referral letters, discharge letters, completed power forms, and clinical documentation. To view a document, simply click on it, and it will open in the window on the right of the screen. More documents can be accessed from the pages at the bottom of the screen. And you can also apply filters to search for specific document type or speciality from the drop-down menu or advanced filter button at the top. Next, we will look at histories. From here, we can see if the patient has any procedures history, any relevant family history that has been recorded, any social histories, including tobacco and alcohol substances, pregnancy history, and implants. From the blue menu, we can also view any patient allergy information. We can also see any outpatient appointments, including any for surgery, any future appointments, and also all past and cancelled appointments. Finally, to access quick reference guides and videos, Select View from the top toolbar. Scroll down and open up eCoach. Guides can be found by looking into the relevant section or by searching using keywords in the search bar in the top right. Select the guide you wish to view and the guide or video will open. Thank you for watching this e-learning video. Further resources are available in IT systems training on our Trust's OLLI.